I came from a very poor background. I came from, if you say somebody's going to be a doctor, you will not point your finger at me because I'm the last you will ever think will become a doctor. I came from a family when my mother put stones on fire and told me and my brother then that it was yam, it was food. We all wept and we slept off. We woke up again, we start crying. So that's kind of home I came from. Even though you are poor, you still can live. If God has given you life, that life is meant to be lived. And you don't need to live through life miserable because you don't have money, sad because you're not eating well. But people can be taught and trained how you can use the small resources you have, the best way, the best way. That's what I'm for. Why pregnant women die in Nigeria is because of poverty. A woman is pregnant, she doesn't come to the hospital. Not that she didn't want to come, but she doesn't have the money to come. A woman comes to the hospital maybe once or twice when she was pregnant, but the time of delivery comes, she disappeared. Why? Because she doesn't have money to pay for the admission, for the delivery. Probably, maybe she was told, well, the presentation of the baby, the way the baby is coming, the baby is not coming with the head, the baby is coming with the foot, or the baby is coming with the shoulder, or the baby is coming with just one hand. Do you understand? And which means a spontaneous vaginal delivery will not be possible. This woman has to do a cesarean section. Do you understand? Now, hearing that is a sad news for such women. The next clinic appointment, you're not going to see them. So such women will now go to a traditional birth attendant. They probably will go to a church mission house for midwives in churches to take their deliveries. And you can imagine what will come out of that. These women will just keep, they will keep laboring. They will keep laboring against a closed opening. So what happens? The uterus will rupture after prolonged contraction, serious forceful contraction, but the baby is not coming out. The uterus ruptures, the woman bleeds, and she dies. Going into public health, a serious drive I have is the drive to help the poor. If you look at it, the serious inequalities between and within countries that obtains right now makes healthcare for the poor to be very difficult. So the only way you can strike a balance between the rich and the poor is to have a public health program where the poor also can benefit at a cost that they can afford. In this school, I was exposed to international teachers, people that have worked with WHO, people that are knowledgeable, people that are well informed, people that are current about the current trends in medicine. And medicine these days is really moving away from therapeutic. Medicine these days is moving towards preventive. Do you understand? Because people are no more concentrating on treating. People are concentrating on, look, what can we do to prevent this thing from happening so that we don't even need to treat? Do you understand? So if that is the trend, now you can agree with me that the best way and the best place to get that kind of knowledge is in Hebrew University, here in Hadassah and Kerem in the state of Israel.